Scapula. In this video, we'll cover its surfaces, borders, key processes, ossification, and clinical importance, including winging of scapula. Let's begin. Scapula is also called shoulder blade. It is a triangular-shaped, flat bone situated in the posterolateral part of the chest wall. Scapula overlaps 2nd to 7th ribs, parts of the scapula. Scapula has two surfaces, anterior and posterior, 3 angles, superior, inferior, and lateral. 3 borders, medial, lateral, and superior. And finally, 3 processes, spinous, acromion, and coracoid process. Anterior or costal surface. It is a triangular fossa, also called as subscapular fossa. Oblique ridges are classically seen on this surface. Muscle attached in fossa is subscapularis. Narrow strip of bone extends along the medial border from superior angle to inferior angle. Gives insertion to serratus anterior muscle. Posterior or dorsal surface. Triangular area of dorsal surface is divided into 2 fossa by shelf-like projections called spinous process. Below the spine, larger triangular area called infraspinous fossa, which gives attachment or origin to infraspinatus muscle. Above the spine, the smaller area called supraspinous fossa. It gives attachment to supraspinatus muscle. Upper lip of spine gives attachment to trapezius. Lower lip of the spine gives origin to deltoid. Posterior or dorsal surface. Lateral border. Lateral border, also called auxiliary border. Extends from lower end of glenoid cavity to inferior angle. Muscles attached on the upper part of lateral border is teres minor, and in lower part teres major. Medial border. Medial border, also called vertebral border, extends from superior angle to inferior angle. Dorsal surface of the medial border gives attachment to levator scapulae, from the superior angle to apex of spine. Rhomboidus minor is attached opposite to apex. Below the apex of the spine, it gives attachment to rhomboidus major. Superior border. This border extends from superior angle to root of coracoid process. Near to the root of the coracoid process, border presents a depression called suprascapular notch. From its medial end, inferior belly of omohoid takes origin. Notch is converted into foramen by transverse scapular ligament through which subscapular nerve passes. Border of scapula. Lateral angle. Lateral angle is represented by glenoid fossa itself. Glenoid fossa is truncated and has pear-shaped glenoid fossa, which articulates with the head of the humerus to form shoulder joint. Above and below there is elevation, called supraglenoid, and infraglenoid tubercle. Supraglenoid tubercle gives attachment to long head of the biceps, and infraglenoid tubercle gives attachment to long head of triceps. Glenoid fossa is deepened by peripheral attachment of glenoid labrum. Vertebral levels of angles of scapula. Superior angle lies opposite to tip of spinous process of T2. Spine of scapula lies at the level of T3. Inferior angle overlaps the 7th intercostal space. It lies at the level of spinous process of T7 vertebra, acromion process, lateral end of spinous process, extends laterally and flattens to form acromion process, which glenoid cavity. It presents medial and lateral borders, tip, dorsal, and inferior surface. Lateral border gives attachment to deltoid muscle. Medial border of the acromion process gives attachment to trapezius muscle. Tip gives attachment to coracoacromial ligament. Medial border anterior part presents an oval facet, which gives articulation with lateral end of clavicle. Coracoid process. It is a bent finger-like projection situated above the glenoid cavity. Consists of lower vertical part, upper horizontal part, and a tip. Tip of coracoid process gives attachment to coracobrachialis and short head of the biceps. Anteromedial border of the coracoid process gives attachment to pectoralis minor and trapezoid, and conoid part of the coracoclavicular ligament. Posterolateral border gives attachment to coracoacromial and coracohumeral ligament. Ossification. Ossified from 8 centers, 1 primary center and 7 secondary centers. Body of scapula including lower 2/3 of glenoid fossa. Ossified from primary center of 8th week of IUL. Secondary center. First secondary center for coracoid process appears at 1st year and fuses at 15th year. Second secondary center is subcoracoid center, appears at 10th year and fuse at 16th year. Third and fourth 2 center for acromion appears at 14 years of age and fuses at the 25th year. Fifth secondary center for part of glenoid cavity appears at 12th to 16th year and fuses at 25th year. Sixth secondary center for medial border appears at 12th to 16th year and fuses at 25th year. Seventh secondary center for inferior angle appears at 12th to 16th year and fuses at 25th year. Applied anatomy. Winging of scapula. Injury to long thoracic nerve leads to paralysis of serratus anterior muscle, leading to elevation of medial border of scapula. This condition is known as winging of scapula. That's the scapula in brief. Like, share, and subscribe for more medical lessons. Thanks for watching.